Sodium balance. Sodium is the main extracellular cation. What is the function of this sodium? Sodium is responsible for about 90% of osmolarity of the extracellular fluid and play an important role in maintaining blood volume and blood pressure. The normal level of sodium in the extracellular fluid is 135 to 145 mole per liter, or the same milli equivalent per liter. Normally, there is a balance between the intake of sodium in the diet, and most sodium is taken in the diet in the form of sodium chloride. And there is a balance between this intake of sodium in the diet and sodium output. Sodium output from the body is mainly in urine, and the small amount is lost in sweat or feces. What is the hormone controlling sodium concentration in the body? Hormones regulating sodium concentration in the body mainly antidiuretic hormone. We take before in water balance, and if there is hyperosmolarity, this will stimulate the osmoreceptors in the hypothalamus, leading to secretion of antidiuretic hormone, or it is the same called the vasopressin. The antidiuretic hormone is released from the hypothalamus and stored in the posterior pituitary, and released from posterior pituitary to produce two actions. First of all, vasoconstriction, and therefore it is called vasopressin, and it produces its main action on the distal renal tubule. It will decrease urine output by reabsorption of water from the distal tubule. It is called the antidiuretic. Antidiuretic decrease amount of urine by absorption of water from the distal tubule. And when water only is reabsorbed from the renal tubule, this will relatively decrease sodium in concentration in the blood and the extracellular fluid. Sodium decrease in concentration because sodium in the body, in the blood and CSF is fixed, but the water absorption from the renal tubule into circulation increase, leading to dilution of this sodium and therefore decrease sodium concentration in blood and extracellular fluid. The second important hormone controlling sodium level in the blood is aldosterone. Aldosterone, any factor leading to hypovolemia, leading to stimulation of, this will produce renal ischemia, leading to stimulation of renin, angiotensin aldosterone system. We all know any renal ischemia will produce renin, which will form angiotensin 1 and 2, which will stimulate aldosterone secretion from the suprarenal gland. Aldosterone produce sodium and water retention. Sodium and water retention leading to maintaining sodium concentration in the blood. In contrast to antidiuretic hormone. Antidiuretic hormone leading to retention of water only, leading to dilution of sodium and decreased sodium concentration. While antidiuretic hormone retention, leading to retention of sodium and water, maintaining blood sodium level. The third hormone controlling sodium is this hormone, which is called atrial natriuretic peptide or hormone. Atrial natriuretic peptide. Natriuretic peptide means produce excretion of sodium. Natrium is sodium. Natriuretic means excessive sodium in urine. If anything leading to stretch of atrial wall. Stretch of atrial wall leading to release of this cardiac hormone, which is called atrial natriuretic peptides. This atrial natriuretic peptides produce two actions. Action on the blood vessel leading to vasodilatation of the blood vessel. And the action on the renal tubule. It produces increase in urinary sodium. Increase urinary sodium and decrease sodium reabsorption into the body. Reduce sodium reabsorption, therefore sodium will be lost in urine. Therefore it's called natriuretic, excessive sodium in urine. And both action, vasodilatation and excessive release of sodium in urine, this lead to restoration of atrial pressure, and atrial pressure become normal. We should notice that in surgery or any trauma, there is hemorrhage, blood loss, this leading to hypovolemia. And the hypovolemia will produce renal ischemia and the activation of renin angiotensin aldosterone system, leading to salt and water retention for about 48 hours after the trauma or surgery. Therefore, we should notice that never give large amount of saline in the first 48 hours after surgery, because already there is sodium retention in the body. These are important points concerning sodium balance, and we'll discuss in the next video hyponatremia and hypernatremia. Thank you for good listening and good luck.